Professor of Law at the Hebrew University of Jerusalem, Netta Barak-Corren. She's joining us live from the city. Professor Barak-Corren, thank you for being with us here on the NewsHour. Now, of course, with the success of the vaccination program in Israel, one country had to be first to reach what is an inevitable point. So where do you stand on how the government there is handling this sort of conundrum that is facing them?
Right. So, as you said, Israel has remarkable success in terms of its vaccination efforts, but it also reached a point in time where it faces a dilemma that other countries will surely face in the future, which is the gap between the percentage of the population needed in order to return to normalcy and the percentage of the population that has vaccinated. And the question is, as you've noted, what to do about this gap. What I and my colleagues argue is that the guiding principle that should set policy on these grounds is the risks, to the extent they exist, to public health posed by people who don't vaccinate. And there are several risks that we should consider. First, as long as the population of the non-vaccinated is still very large, which is unfortunately still the situation in Israel, also due to children who simply cannot get vaccinated because it's has not been yet proven to be safe for them, then there's still lots of concerns about public health and what will happen if the pandemic breaks out again, and there will be a fourth wave in Israel, actually, of large-scale infection. So the collateral health damages that the unvaccinated population still pose are still significantly large in in Israel. And therefore, what should be the guiding principle when you're thinking about allowing, again, mass gatherings, hundreds, thousands of people again? This hasn't been allowed in Israel for over a year. You want to control the risk to health, then distinctions such as the green passport make sense as long as this is a situation. Of course, the more people get vaccinated and the more we have additional medical evidence that tells us more about the risks now that such a big percentage of the population is vaccinated, the more we'll know whether we can take less precautions and open more and more activities with less restrictions. I think it's very important to emphasize that any restriction on access to public activities should always be proportional and narrowly tailored to achieve the legitimate public policy goals. So, for example, I don't think it's legitimate for a state and for Israel specifically to withhold access to vital activities or services, such as, for example, hospitals. And also, we advocate strongly for the alternative to provide some kind of safety badge. So, for example, to have a recent negative coronavirus test as an alternative to vaccination in order to still gain access to public spaces.
I mean, it's a fascinating moment for us to come to, Professor. And I do wonder, you're a professor of law, but there feels like there's a moral element to this as well, because the evidence seems to suggest that once you are vaccinated, you can then not transmit the COVID, the virus, as deadly as it was previously. So what we may well be left with is a community of people who aren't vaccinated, who are then transmitting the virus amongst themselves. And I know that, for example, the ultra-Orthodox community are quite reticent to be vaccinated. So how do you access those people who will need for the vaccination program to work for them?
So first, I think it's really important to note that a pandemic, by definition, is a collective phenomenon. And in every state, if a significantly large group does not vaccinate, then it's not just that group's interest. It affects the whole country. And we've seen that, unfortunately, very acutely with the ultra-Orthodox population. I do want to correct and say that the ultra-Orthodox population is very diverse, and large segments of that population do get vaccinated and have been vaccinated. There are pockets of objection to vaccination, to inoculation in the ultra-Orthodox, but it's not limited. So the objection to vaccination in Israel is certainly not limited to the ultra-Orthodox. It also exists in other groups, and also there are some who are hesitant. They're not ideologically opposed. They're hesitant. And of course, the authorities should convey all of the scientific information, because we know it's The woman who you interviewed before was saying fake news about the vaccine. There are lots of scientific evidence by now that was accumulated by the scientific community. We know that the vaccine is effective, it's efficient, and we also know that it's safe. And as you said, there's also
Professor.
preliminary evidence that that vaccinated individuals are less infect less than the non-vaccinated.
Absolutely right. I'm sorry to interrupt you, Professor. We could talk about this all day, but we have run out of time. And thank you for correcting me on the ultra-Orthodox community. I do appreciate your time, and I wish you and your colleagues luck in helping guide that policy.